Well, I know for you specifically, dry eyes has been an issue over the years. And you just mentioned being in the indoors in the winter and looking at screens being issues that could flare that up.
Hmm.
But what other things cause that?
So dry eye is really quite complex. For myself, I've been in front of a screen since I was a kid. I played a lot of video games, watched a lot of movies, and read a lot of books. I was very much an indoors kid. Uh, but I got contact lenses at age of 13, 14, and they were amazing. They transformed my life. The downside is contact lenses they help with the evaporation of your tears. So your tears evaporate much faster, and they also may potentially cause micro changes to the neuroanatomy of the cornea because your body produces more tears based on ambient temperature readings by the nerves in the surface of the eye. And so it's constantly sampling, hey, how warm is the room? And if the temperature in the room changes, even by like 1 or 2 degrees, your eye detects this and will say, I need to make more tears. Uh, and so if you're wearing contact lenses, not only do you have this plastic shield covering these nerves, the surface of the eye, but then the mechanical friction of the contact lens on the eye, especially over a long enough timeline, uh, also is known to cause damage to those nerve endings. And so, especially if you're at risk of dry eye, there's always the question if your doctor recommends contact lenses is a good option for you. Some people who with really extreme dry eye may have to drop out of contacts. Um, Other factors that influence dry eyes, I hate to say it, age. We know that as people get older, risk of dry eye goes up. That may be due to hormone changes, as women in premenopause and menopause definitely get dry eye faster and more often than men. Cosmetic use may play a role. Like we talked about at the very beginning, uh, inflammation on the eyelids due to blepharitis or this buildup of skin oils. That's why cleaning the eyelids is so good. That can contribute to dry eye. Uh, Even diet and sleep are affected, have been found to be connected to dry eye. It is a multifactorial disease, but we're seeing this increased amount of people with dry eye disease, even in young teenagers. Uh, and part of that is because the eyelids have these oil glands in them called meibomian glands. And every time you blink, a little bit of this oil comes out, and this oil mixes with your tears and prevents them from evaporating. However, these oil glands, we're finding younger and younger people are having this dysfunction where these glands are getting clogged and then they're dying off. And there's at least some publications that kind of connect to this hypothesis that the amount of screen use and this lack of blinking that we're doing is leading to these glands not being used, and then these glands are clogging up and atrophying. Uh, that's at least the current theory, but it seems plausible.
What about on the other end of the spectrum? Somebody who has wet eyes,
Mhm.
their eyes are weeping.
There's a few causes of wet eyes. The medical term is called epiphora. Uh, for some cases, if it's sporadically throughout the day, right? You know, when you first wake up, my eyes are wet, they're not dry. Or after I'm on the computer for a few hours, they're more wet. Or I even have some patients where they are retired and they love to read, but they only feel like every time they read, after 5 minutes, their eyes start to water all the time. That type of tearing that's sporadic is likely reflex tearing that's actually caused by dry eye. It's a funny enigma, but your body's really good at detecting dryness. And if you have dryness, your body, like your nerve cells may have become numb to the dryness where you don't think they're dry, but your body detects it's dry and there's damage occurring. So your body makes new tears, a flood of tears, to try and bring moisture back to the surface and heal. Uh, so again, if it's sporadic, it could be reflex tearing. For other people, especially if it's like one side, like I had a patient the other week who is their left eye was watery all day long, every day, and it's been going on for like 2, 3 months. And it's just like they have to bring tissues with them everywhere. And now they even have like, it looks like they have sore tissue, like a very soft, irritated skin around the eyes because it's constantly watering. And in cases like that, it was a blocked tear duct. This can get blocked for many different reasons: inflammation, something, dust of particles or something got stuck in their tear film and it went down the drainage canal by the nose and got clogged. In that case, thankfully, I had her back in. We did what's called a dilation and irrigation procedure, where we just take saline solution and we have a special tool that we put into the drainage canal and just flush it really hard. And I would say 80% of the time for myself, I probably experience that will just flush the blockage downstream and then it's clear. There are some scenarios where it doesn't break down, and then I'll refer for a surgical consult because they can do a procedure where they basically have to surgically clean up the drainage canal.
For somebody at home that's feeling like they have a mild clog of that
Mhm.
canal, anything they can try before seeing somebody like you?
Uh, it's tough. Generally, no. They could see an eye doctor, and maybe I know some practitioners who prescribe topical steroid eye drops for a short period of time to see if it's an inflammatory cause, if the steroids will calm things down and open things up. I've never found too much success with that strategy. For young kids, it's a different mechanism going on, but like young babies sometimes can be born where their tear duct isn't even open yet. And so they'll encourage, like pediatric surgeons will recommend that parents do like a massage on the eye, on the tear duct here on the nose, right by the eye, to try and encourage the duct to open up. But usually it opens up on its own within the first year of life anyway.
As you're talking about massaging there inside the nose, it gets me thinking about one of your videos where you talk about not massaging the eyeballs.
Yeah.
Talk about why that's something to avoid.
Thanks for asking that. This is something I don't get from too many people, but doctors will recommend this. If you've ever gone to see an eye doctor, sometimes we'll say, "Hey, don't rub your eyes." Especially we'll tell this to young kids, because some young kids but have bad allergies, or they just have like this bad habit of rubbing their eyes, and it's not just gently rubbing their eyelids; they're like grinding their knuckles into their eyeball. And again, they may feel it may feel good to them because they feel like they have allergies or something's irritating their eyes, but there's an increased risk associated with hard rubbing of the eye of an eye disease called keratoconus. This is where the cornea, the front surface of the eye, becomes warped and becomes progressively thin. And as it thins out, the surface of the eye takes the shape of a cone. Again, hence the name, keratoconus. Uh, this condition, unfortunately, is progressive. And so it often shows up in like teenage years, but we'll see it slowly progress and get worse and worse over someone's early adulthood. And it can cause their vision to be so blurry and distorted that even glasses can't fully correct it. They usually end up needing specialty custom fit contact lenses, or if it thins enough, it can scar, and then they may even need a corneal transplant. Um, it does tend to run in some families, not always, but we know that rubbing of the eyes is a risk factor. So we always try to encourage anybody who may be at risk of it, whether it runs in families or if somebody's diagnosed with astigmatism, if you've ever heard that term before. If like a young kid has a high risk of astigmatism or they're showing signs of it, we'll often recommend to them to not rub the eyes.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
Diabetes affects the eyes significantly. Not only does diabetes increase the risk for things like cataracts, diabetes affects the blood vessels throughout your body. And the retina in the back of the eye is one of the most highly vascular organs in your body.